Hi friends, hope you're doing well. I'm Dr. Milind. So here I'm presenting the third part of choosing a branch. So in this video we have lot to discuss. So in this video we'll discuss about the preclinical branches, the unconventional branches which are very different and people don't have much idea about it, and also about the 6-year courses which are there to offer through MD through NEET for MD, MS, and for DNB. So we will discuss about these courses, that what are the pros and cons, and the opinion that I am expressing in this video are based on my experience, and also I have talked with the students who are pursuing these courses. So let's start today's topic. So I'll discuss the likewise subjects and branches together. So let's start the anatomy and physiology. So the students who wants to pursue MD in anatomy and physiology. So what are the pros? So we have fixed hours. There are no emergencies, and those who are very much interested into teaching, definitely they can take these branches. But and also there is an opportunity of research. Why I have said plus or minus, because as compared to the other preclinical branches, I feel anatomy has a limited research opportunities. What are the cons? So definitely there is a no much recognition, because being an anatomist, like after doing MBBS, like when you want to do some patient related work, so anatomy suddenly becomes a different way, so less recognition. Also there is a limited money, like being an anatomist in physiology, it's the more opportunities are in the medical colleges, so we'll always have a limited amount of money that you will be earning, that the salary that you will be getting, and definitely there will be there will be limited, or I'll rather say no clinical touch. So if you're someone who wants to have a clinical touch, then definitely this is not something that you can think about. Let's move to the next. So pathology and biochemistry. So these branches have a little bit different from anatomy and physiology. So definitely initial three things are same: fixed hours, no emergencies, and teaching opportunities. But here you can set up a pathology or a biochemistry lab, so which can be your actually a monetary source. So what are the cons? So definitely there is a problem with the recognition. Again, as compared to the clinical branches, you need an infrastructure to build a lab. You need that infrastructure. Also about self satisfaction. So I have read few articles, like not only for this video but in the past also I have seen about that pathologists and biochemists, the level of self satisfaction is less as compared to the other branches. So this is not actually for everyone. This is just the article I came across, and I thought I'll put it here just to know. You can definitely have a talk with the students who are already pursuing the branch to have a more clarification on that. And definitely there is a lot of competition. As you can see, there are a lot of corporate labs out there in the market which will be competing with you. So you have to make your mark, you have to make your brand, like labs like Lalpath Lab are there, and there is Metropolis. So these labs are already established, and in most of the metro and urban areas. So definitely you have to think about this part as well. Now coming to the pharma and microbiology. So these two also are different from the rest four preclinical branches, because they have more of a research based branches. So initial three are same for them also: fixed hours, no emergencies, and teaching opportunity. But pharma and micro offer additional research opportunities as compared to the other branches. Also, if you're someone looking for a corporate kind of job or a research opportunity overseas, like abroad, then definitely you can pursue pharma micro kind of branches. Then there is also a problem with the recognition, which I like to put in a cons. There is also competition for job, being a microbiologist and pharma. So mostly you get for example, the pharma, after doing MBBS pharma, there are also students from the pharma stream which will be competing with you for the job. So you might have a difficulty in finding a job. But if you are someone who are interested in teaching and research simultaneously, so this is something very good for you. I would also like to emphasize one point regarding these preclinical branches, that we have discussed about the recognition, but what one major point I have noted, that if you want to excel in administration, like if you want to someone who had a interest in administration, then you can definitely pursue these branches. Like after doing a microbiology and pharma, you can also become like a dean or a director of a medical college. So basically, you started your journey as a preclinical, but one day you will be dictating terms to the medicine and other clinical branches, that how they should function. Because even where I studied AIMS Bhopal, we had a director who was MD microbiology. So our director was someone who had pursued his MD degree in microbiology, and he was from AIMS New Delhi. Also, what I like to see the students who are interested in a preclinical branches, it's always better if you do it from the apex institutes. Like if you do it institute like AIMS or the topmost state colleges, then you get a better opportunity. If you do a pharma, micro or such branches from the very peripheral colleges, then the opportunities will be very limited. But if you do it from a very premier institute, suppose if your branch is something that can fetch you such kind of branch in a premier institute, then try to select a good institute for that. And that is, I think, something that will help you excelling in the administration kind of work. So definitely, if you are thinking about the recognition, you can actually turn the tables and you can become a director and dean of some college someday. About social and preventive medicine, so this is also a branch less. I mean, the students are a little bit unaware. So there are also fixed hours, no emergencies, and teaching. What additionally PSM offers is a field work. So the students who are who likes to travel and who likes to go out there and talk to people and want to solve the people's problem and going to the roots, as we say. So you can definitely look for this branch as an opportunity. Also, one thing I would like to tell about PSM as well, that you can get a government post opportunities. I have known some students who have worked for WHO after completing their degree in social and preventive medicine. Also, again, the same point I would like to say, that if you want to pursue branches like PSM, do it from the apex institutes. Do it from a good institute. There's no point doing it from like very peripheral colleges just for the sake of degree. Then you can just only option you will have is a teaching. But if you do it from a apex institute, the government post opportunities opens up. So that is also one thing that you can consider. What are the cons? Again, recognition. See, when I say recognition, that in your field you will be highly recognized. But when I say recognition, I mean society, because our society is very, has very unrealistic expectations, and they have habit to only, worship those which looks very glorious. So definitely, a recognition is a problem in the society, but definitely these are good opportunities. You have to do a lot of put in a lot of hard work, that you have to travel, you have to go to the places, you have to talk to the people, you have to convince people for something which is very difficult, and especially to the population which is illiterate. So that is a lot of hard work you have to put. Also, if you're someone who is not very fond of calculations, biostatistics and analysis, because this is an integral part of PSM. Whenever you are conducting any study, any field work, you have to present it in the form of some data and some results you have to formulate. So this is something, if you are not very much interested, then you have to think about it. Now coming to the next branch, forensic medicine and toxicology. So this is also a very interesting branch. Again, have a fixed hours, no emergencies. Also, if you're someone interested in teaching, one additional thing it offers is a thrilling. So if you're someone who is like want to do some adventurous things, so definitely it is a good branch, because you'll be visiting the crime scenes. You'll be visiting the areas where the accidental where accident have happened. So accident scenes you will be visiting. So if you're someone that who likes this kind of thing, so you can definitely be a part of investigation and you can enjoy. Some people like to like this can be work in a both way. So that is why I have included in the cons. So it is not for the faint hearted. So visiting a crime scene or seeing the accidents or doing the autopsy per se. Because I remember when I attended my first autopsy, I did not feel very comfortable, and this is for someone who is comfortable with that. Also, being a I think this expert, you can have some job opportunities in the government as a crime specialist, but there are definitely limited job opportunities, because you will have to be dependent on someone. You cannot start your like autopsy lab or something. You'll have to be dependent on someone. Now, talking about radiotherapy and nuclear medicine. So before discussing about them, let's talk about it. So radiotherapy is more of a treatment branch. So here, what we do, it is used in oncology, especially for oncology, where we need a radiological treatment. So radiations are used for a for the treatment. So this is very different from radiodiagnosis. So radiodiagnosis, as the word said, is basically a diagnostic modality, and radiotherapy is a treatment modality. So whenever we use radiations like gamma knife and all these things, so that will be coming under radiotherapy. What is a nuclear medicine? So nuclear medicine is more of a diagnostic branch and little bit of a therapeutic branch as well. What is nuclear medicine? Here you give a radioactive isotope to a patient, and he will consume that, and then you will that radiation that the radioisotope will be emitting will be captured by the cameras, and you will diagnose. Also, in a treatment modality, you must have seen about iodine 131 radioisotope, which is used for thyroid related problems. So this is used as a treatment approach. So basically here the patient will be himself will be consuming a radioactive and emitting a radiation. Here in radiotherapy, a radiation will be given through a machinery. So this is a kind of difference that both the this is the thing, like nuclear scintigraphy comes under the nuclear medicine, which the graphs we get in exam. So these are basically two branches. So what are the pros and cons? So talking about the pros, for the branch, so it is a fixed hours, no emergencies, as I said, less stress as compared to the other branches, and those cities which are emerging, like new cities that are being forming, so where new hospitals are being constructed, like big hospitals, so they can offer you a good job. New cancer centers are coming, so they can offer you a job. What are the cons for this? I will say that the metro cities, I mean already established cities, see, there is a difference. Emerging cities means like cities which are small cities which are now growing into metro and new hospitals are coming. So there you have an opportunity. But the cities like Mumbai, Delhi, Pune, or I'll say Chennai, Kolkata, I think they are already saturated because metro cities already have a lot of. And if you are someone who thinking that these are new branches, no, definitely not. Nearly 15-20 years back, these branches were started, and there are already specialists out there. So a particular city will need a limited number of specialists. So that is what problem with that. So metro cities are already saturated. Also, there are limitations of job. To be a radiotherapist or a nuclear medicine guy, you need a setup. Without setup, you cannot do it. You cannot have your own setup. You cannot, because it's a very expensive thing. And also, you need that particular patient. Like you need a oncological patients. So you need a hospital catering oncologist, oncology patients, and you need a setup which is offering this treatment facilities. So there are definitely limitations. And also the salary. If you are working a teaching institute in a medical college, you'll get a salary, but in a private setup, the salary can be a limitation. So these are, and also the exposure to the radioactive material always remains a risk factor. Now there is a branch called hospital administration. So there is also this branch available under a lot of. This is also available in AIMS New Delhi and other colleges. So about hospital administration. So again, you have a fixed hours. If you are someone who loves a corporate feeling, who, like, a lot of students after doing MBBS search for alternate option, who are not very happy with, like after internship suddenly you feel like I don't want to do this anymore. So some students go and choose IAS, like UPSC. So this is also alternate route. So you can get a corporate kind of feeling. If you're someone who likes to be a leader and have this quality to be a leader and to lead something, so this is for you. And also it offers you recognition. So it's like you run and manage a hospital. So that is also something that is good as a, if you want to pursue a hospital administration. But what are the cons? And I'll say it is limited to metro cities. Like, your job profile is limited to the metro cities. It's a dependent job, and it just offers you won't be a only person who will be doing the hospital administration. There are a lot of students from other stream also do hospital administration. And also you need to put in a lot of hard work because you are running a hospital and running a setup. So whoever is your employer, you have to give him the results, and you have to put in a lot of efforts for bringing the best out of the things. So I think that has the pros and cons, but it is also alternate route for the students who can choose this branch. Then there is one branch, family medicine, which is usually offered under DNB, and also some hospitals and some like corporate hospitals offer this branch. So there, I'll not talk about pros and cons because this branch is like, I will say it's a similar like medicine, but they have given it a name of family medicine. So this is a very good option for a peripheral and rural areas and a semi-urban areas. So if you are a student who is from a semi-urban place or a small city, a small town, and who does not want to pursue like MD medicine, or does not have a rank that will fetch MD medicine, or does not want to have that hectic life, and but who wants a feeling of a doctor, and who wants something just more than MBBS, like who wants to be someone more than MBBS. So definitely you can go for a family medicine. You can make a decent money, like you can run your own OPD, and with OPD, once you start your setup and once you get established, you can make a good money. And also in a society you get a good recognition being a family physician. So this is also a very good branch for those who want to pursue a MD medicine like a branch, or who are happy with MBBS but just want something more than MBBS. But the one con I will like to tell you that if you are from a metro city, then definitely you will have a problem and competition from the MD medicine. And if you want to go and search a job or in a teaching hospital, then you will have a difficulty in getting a job because there will be many MD candidates ahead of you. So this is something a very interesting things about this branch. Then coming to the emergency medicine. So emergency medicine is something that I had also joined during the initial period of my career. What I liked about emergencies, there was a fixed hours and it was a very thrilling branch. I remember during my I worked in emergency medicine in AIMS New Delhi. It was very adventurous branch, very thrilling, and it was a very good. I liked the branch. But what was the problem? Like, it has a fixed hours. What I like that, after, like, if you are in a morning shift, your work hours are like 8 to 2, 2 to 8, and night 8 to 8. So after you give over, your work is done. So that what I used to like about the branch. But what are the cons? Is saturation of work. So this is why I'm saying this first, because what I realized that, I like emergency, but this is not something I'll do for life. I want like break in between. I want to see like OPD in between. I cannot do emergencies all the time. So this is for someone who loves doing emergencies, who does not like to talk to people a lot like in OPD, but who likes to work instead of talking. So this is for someone like that. So I feel that cons is a saturation of a work. Also, a absent job profile. So emergency medicine is provided by AIMS New Delhi, also AIMS Raipur, and there are other medical colleges who through NEET also provide this branch. But if you go in a corporate hospital looking for a job, so there is a absent job profile because emergencies ICUs are taken care by the MD medicine guys and also by the anesthesia nowadays. The critical care taken by the anesthesia. So there is some limitation of a job profile and limited job opportunities as you have a competition with the anesthetist and MD medicine guys. But definitely it's a good branch if you're looking for a career. Then geriatrics. So geriatrics, this is a branch. This is provided by MD in AIMS New Delhi. Also, some few very few hospitals from NEET also provide this branch. So basically, geriatrics is a medicine only, but it is for the population above 60 to 65 years. So you can say it's like a pediatrics up to 18 years, medicine up to 65 years, and then geriatrics after 65 years. So these are the same things at a different age group. So this is offered at AIMS Delhi. So what I will say that these branches are good for a non-metro and a non-urban areas, because basically what you will be doing is a MD medicine only. Just legally you are bound for some population, or I can say that your degree bounds to a certain population. But if you practice in a non-metro and non-urban areas, then you can practice as a as a MD medicine. I'm not saying you are allowed as a MD medicine. I am saying that you can see a patient as of any age. But if you are in a metro city or urban areas, then the guy MD medicine and other people can create a problem, like you are seeing the patient below that years which you are not allowed, and which is actually very funny. I feel that I mean, what is the difference between a 65-year-old and a 63-year-old? So but that happens, like whenever there's a competition, then it can get fierce. So this is a very interesting fact. So definitely, if you are someone who are trying to settle down in a small city or a non-urban area, and you want to study in AIMS Delhi at the same time, because you are trained like a MD medicine, this comes under MD medicine only. So I think that you can definitely think of, and you can make a decent money running your own OPD there. Problem with this branch is less awareness and recognition among Indian population. Then lastly, coming to the 6-year courses. So there are some 6-year courses that are offered. Neurology and neurosurgery offers in NIMANS. Neurosurgery offers in AIMS New Delhi. Then there are CTVS offers by some DNB institutes. Pediatric surgery again offered by AIMS New Delhi and few other institutes. And infectious diseases DM again offered by AIMS New Delhi. So first I will talk about the surgical branches. See, I feel that doing a 6-year courses in a surgical branches is a very good choice because it saves a lot of years. But I'm talking about the neurosurgery and pediatric surgery. If you want a neurosurgery in AIMS New Delhi, you have to be in a top 30-40 ranks in INI. So that is the high, and also for the NIMANS. So you need a very higher rank. So I think neurosurgery, there is no point in discussion. I mean, it is the best branch, and there are no pros and cons. CTVS through DNB. The only problem is with the DNB teaching hospital is the exposure and the opportunities that you get to work. See, you are going to become a surgeon. So DNB hospitals are usually corporate hospitals. So sometimes the patients are also treated differently. So there is a problem that sometimes they will not let you touch the patient, and they will not give you the exposure in the initial part of your residency. Like initial 2-3 years, they might not because I have heard from few students that they don't touch you the patient as much as they do in a government hospital, because being a corporate setup, that is a problem. But there is also saying that once you become a senior, then you can do all the procedures. So CTV is also good choice. But you, thus DNB Institute should be a good institute. And learning is, again, always I say, it's individualized, that how much one want to learn, and the confidence that you are going to present in front of your seniors, so they will present you with the opportunities. Pediatric surgery is also a good branch which is offered in AIMS Delhi and also in AIMS Jodhpur, so definitely you can go for that branch. Then talking about the infectious disease, so this is also was a branch, like during my like when I got my rank, I was thinking very seriously about taking a DM infectious disease. Now, what is the problem with DM infectious diseases? It's a relatively new branch in AIMS like institutes, because when I was looking around in 2018, when I was looking for a branch, so the first student was in, I think, second or third year, and I had a discussion with that ma'am there. I went to AIMS New Delhi and had a talk. So the infectious disease basically is 3 years of MD medicine and 3 years of MD microbiology, and the problem is, the student who have done MD microbiology, they can also apply for a DM infectious disease after microbiology, and students who have done MD medicine can also apply for DM infectious disease after doing the MD medicine. So the problem is, initial 3 years you are posted in MD medicine, and after 3 years you are posted in the microbiology. So after, once you are a DM infectious disease, you can practice as a DM infectious disease guy. Now, what problem I feel here, that this is a still new branch, and I think, because I'm talking about the pre-COVID era when I had this talk, but now I feel that this branch definitely has a very bright future, particularly the infectious disease, because you can have a very good job opportunity in a medical college, because lot of infectious diseases are emerging. So you stand a very good opportunity being an expert in MD medicine as well and in a microbiology as well. So you can have a good job profile, so I feel. And your time is saved, because you are finishing a course in a 6 years, so you don't have to write another entrance, so you just get a DM degree directly. Also, what is interesting about the New Delhi courses of 6 years, that you can write your exam at the fifth year, and your last year is considered as a senior residency, so that is also a interesting part. So you can write your exam in fifth year also, and you can do a last 1 year as a residency, and your 6 years are completed. So you can have a directly a job profile, and lot of time is saved. So that is what I have to say about the 6 years courses. So I hope, guys, this video helps you. I have tried to share my experience and my whatever I know about the branches with you, and I hope it helps. So I wish you all the best and take care.